Hello and welcome to Women's Health Issues, a channel that talks about health issues affecting women, causes, symptoms, and treatment methods if possible. So today we are going to talk about ovarian cysts. So what is an ovarian cyst? Ovarian cysts are fluid-filled sacs in the ovary. They are common and usually formed during ovulation. Ovulation happens when the ovary releases an egg each month. Many women with ovarian cysts do not have symptoms. The cysts are usually harmless. So what are the different types of ovarian cysts? The most common types of ovarian cysts, called functional cysts, form during the menstrual cycle. They are usually benign meaning they are not cancerous. The two most common types of cysts are follicle cysts. A follicle cyst in a normal menstrual cycle, an ovary releases an egg each month. The egg grows inside a tiny sac called a follicle. When the egg matures, the follicle breaks open to release the egg. Follicle cysts form when the follicle doesn't break open to release the egg. This causes the follicle to continue growing into a cyst. Follicle cysts often have no symptoms and go away in 1 to 3 months. So the other types of cysts is a corpus luteum cyst. Once the follicle breaks open and releases the egg, the empty follicle sac shrinks into a mass of cells called corpus luteum. Corpus luteum makes hormones to prepare for the next egg for the next menstrual cycle. Corpus luteum cysts form if the sac doesn't shrink. Instead, the sac reseals itself after the egg is released, and then fluid builds up inside. Most corpus luteum cysts go away after a few weeks, but they can grow to almost 4 inches wide. They also may bleed or twist the ovary and cause pain. Some medicines cause ovulation can raise the risk of getting these cysts. Other types of benign ovarian cysts are less common. The first one is endometrial mass, which is called by endometriosis. So that is endometrial mass, which is caused by endometriosis. Endometriosis happens when the lining of the uterus grows outside of the uterus. Dermoids, which come from cells present from birth and do not usually cause symptoms. Cystadermas, which are filled with water fluid and can cause growth. These growths are normally large. In some women, the ovaries make many small cysts. This is called polycystic ovary syndrome or PCOS. PCOS can cause problems with the ovaries and with getting pregnant. Malignant or cancer cysts are rare. They are more common in older women. Cancerous cysts are ovarian cancer. For this reason, ovarian cysts should be checked by your doctor. Most ovarian cysts are not cancerous. So who is more likely to get an ovarian cyst? Ovarian cysts are common with women with regular periods. In fact, most women make at least one follicle or corpus luteum cyst each month. You may not be aware that you have a cyst unless there is a problem that causes the cyst to grow or if multiple cysts form. About 8% of premenopausal women develop large cysts that need treatment. Ovarian cysts are less common after menopause. Postmenopausal women with ovarian cysts are at higher risk for ovarian cancer. At any age, see your doctor if you think you have a cyst. See your doctor also if you have symptoms such as bloating, needing to urinate more often, pelvic pressure or pain, abdominal, unusual vaginal bleeding. These can be signs of a cyst or other serious problems. So what causes ovarian cysts? The three most common causes of ovarian cysts include 1. Hormonal problems. Functional cysts usually go away on their own without treatment. They may be caused by hormonal problems or by drugs used to help you ovulate. 2. Endometriosis. Women with endometriosis can develop a type of ovarian cyst called endometrioma. The endometriosis tissue may attach to the ovary and form a growth. These cysts can be painful during sex and during your period. 3. Pregnancy. An ovarian cyst normally develops in early pregnancy to help support the pregnancy until the placenta forms. Sometimes the cyst stays on the ovary until later in the pregnancy and may need to be removed. 4. Severe pelvic infections. Infections can spread to the ovaries and fallopian tubes and cause cysts to form. So what are the symptoms of ovarian cysts? Most ovarian cysts are small and don't cause symptoms. If a cyst does cause symptoms, you may have pressure, bloating, swelling, or pain in the lower abdomen on the side of the cyst. This pain may be sharp or dull and may come and go. If a cyst ruptures, it can cause sudden, severe pain. If a cyst causes twisting of an ovary, you may have pain along with nausea and vomiting. Less common symptoms of ovarian cysts may include, but not limited to, pelvic pain, dull ache in the lower back and thighs, problems emptying the bladder or bowel completely, pain during sex, unexplained weight gain, pain during your period, unusual vaginal bleeding, a tenderness of the breasts, and needing to urinate more often. So how are ovarian cysts found? How are they detected? If you have symptoms of ovarian cysts, talk to your doctor. Your doctor may do a pelvic exam to feel for swelling of a cyst on your ovary. If a cyst is found, your doctor will either watch and wait or order tests to help plan treatment. Tests include ultrasound. This test uses sound waves to create images of the body. With ultrasound, your doctor can see the cyst's shape, size, location, and mass. Pregnancy tests to rule out pregnancy. Hormone level tests to see if there are hormone related problems, and blood tests. Are ovarian cysts ever an emergency? Yes, sometimes. If your doctor told you that you have an ovarian cyst and you have any of the following symptoms, please get medical help right away. If you suffer from rapid breathing, faintness, dizziness or weakness, sudden severe abdominal pain, or pain with fever and vomiting, these symptoms could mean that your cyst has broken open or it has ruptured. Sometimes large ruptured cysts can cause heavy bleeding. So, question, will your ovarian cyst require surgery? Well, maybe. The National Institute of Health indicates that 5 to 10% of women have surgery to remove an ovarian cyst. Only 13 to 21% of these cysts are cancerous. Your cyst may require surgery if you are past menopause or if your cyst, 1, does not go away after several menstrual cycles, 2, if it gets larger, 3, if it looks unusual on the ultrasound, and 4, if it causes you extended pain. If your cyst does not require surgery, your doctor may 1, talk to you about pain medicine. Your doctor may recommend over-the-counter medicine or prescribe stronger medicine for pain relief. 2, prescribe hormonal birth control if you have cysts often. Hormonal birth control, such as the pill, vaginal ring, shot, or patch, help prevent ovulation. This may lower your chances of getting more cysts. So, what types of surgeries remove ovarian cysts? If your cyst requires surgery, your doctor will either remove just the cyst or an entire ovary. Surgery can be done in two different ways. A laparoscopy. With this type of surgery, the doctor makes a very small cut above or below your belly button to look inside your pelvic area and remove the cyst. This is often recommended for smaller cysts that look benign. Benign means it's not cancerous. 2. A laparotomy. This means your doctor may choose this method if the cyst is large and may be cancerous. This surgery requires a larger cut in the abdomen to remove the cyst. The cyst is then tested for cancer. If it is likely to be cancerous, it is best to see a oncologist who may need to remove the ovary and other tissues like the uterus. So, can ovarian cysts lead to cancer? Yes, some ovarian cysts can become cancerous, but most ovarian cysts are never cancerous. They never become cancerous. The risk for ovarian cancer increases as women get older. Women who are past menopause with ovarian cysts have a higher risk for ovarian cancer. Talk to your doctor about your risk for ovarian cancer. Screening for ovarian cancer is not recommended for most women. This is because testing can lead to false positives. A false positive is a test result that says a woman has ovarian cancer when she does not have any at all. Can ovarian cysts make it harder to get pregnant? Typically, no, not really. Most ovarian cysts do not affect your chances of getting pregnant. Sometimes, though, the illness causes the cyst can make it larger and harder to get pregnant. Two conditions that cause ovarian cysts and affect fertility are endometriosis, which happens when the lining of your uterus grows outside of the uterus. Cysts caused by endometriosis are called endometriomas. 2. Polycystic ovary syndrome, or PCOS, is one of the leading causes of infertility in women. Women with PCOS often have many small cysts on their ovaries. How do ovarian cysts affect your pregnancy? Ovarian cysts are common during pregnancy. Typically, these cysts are benign, meaning they are not cancerous, and are harmless. Ovarian cysts that continue to grow during pregnancy can rupture or twist and cause problems during childbirth. Your doctor will monitor any ovarian cysts found during your pregnancy. Can you prevent an ovarian cyst? Well, no, you cannot prevent ovarian cysts from forming if you are ovulating. If you get ovarian cysts often, your doctor may prescribe hormonal birth control to stop you from ovulating. This will help lower your risk of getting new cysts. So this ends today's lesson on ovarian cysts. So if you like our message, you can leave a comment, you can like our video, you can subscribe. Link to subscribe to our channel is in the description below. And until the next time, we'll be covering more health problems affecting mostly women. So until the next time, peace out. Bye, y'all.